Rational Wellness Podcasters. Dr. Ben Weitz here. I'm so glad you could join me today for another episode of the Rational Wellness Podcast. Each week, I'll be bringing you the latest cutting-edge information on health and nutrition. In this media-driven world, it's easy to be confused about what's true and what's not. I'll cut through the conflicting headlines to bring you clarity, to help you optimize your health and maximize your life. Please subscribe to the Rational Wellness Podcast on iTunes, Stitcher, or YouTube. None of the information in this podcast is intended to diagnose any condition, and this podcast is not intended to substitute for going to see your medical doctor and getting sound medical advice. So let's get started on your path to better health.
You think just finding its way and we are.
29 million Americans have diabetes and 86 million have pre-diabetes, which means that nearly 50% of adults in the US have either diabetes or pre-diabetes. And rates of diabetes have been increasing at an alarming rate in the United States. Diabetics have a 50% increased risk of dying, and we spend over $250 billion a year on medical costs for diabetes. And of course, diabetes is basically a preventable disease. Obesity is also caused by the same underlying condition as diabetes, essentially insulin resistance. And the term diabesity has come into common usage now. Dr. Francine Kaufman originally defined this term as being a metabolic condition with the following set of symptoms. Number one, abdominal obesity, which is weight around the middle. Dyslipidemia, which is alterations in your cholesterol levels. High blood pressure. High blood sugar, your fasting blood sugar above 100. Systemic inflammation, which can be measured by CRP, and a tendency to form blood clots. Obviously, these are not positive things and are going to increase our risk of a heart attack or stroke. If there was ever a disease caused by our modern lifestyle, it is type 2 diabetes. Type 1 diabetes, by contrast, typically starts in childhood and is at least partly related to genetics. But this only accounts for 5% of diabetics. Type 2 diabetes, however, is marked by increasing insulin resistance, which results from the consumption of high glycemic carbohydrates, as well as sugar. Now, insulin resistance is when the cells of the body become resistant to insulin. When you consume sugar or some high glycemic carbohydrates, like some breakfast cereal or some bagel or something like that, your blood sugar rises. And then your pancreas must secrete insulin to lower those blood sugar levels. The sharper the spike in blood sugar, the more insulin is likely to be secreted. And of course, insulin is very inflammatory to the cells. The cells really don't like it, so they start to wall themselves off from this insulin. And that's what's known as insulin resistance. The next time your blood sugar spikes, the pancreas will have to secrete a little more insulin to get those muscle cells to respond and bring in that blood sugar from the bloodstream, thereby lowering your blood sugar to a reasonable level. Over time, the pancreas is being asked to secrete more and more insulin until the pancreas is so overtaxed that it can no longer respond. At this point, you will need to take injections of insulin. This is known as insulin-dependent diabetes. This is the metabolic process that leads to type 2 diabetes and eventually to insulin dependence. Now I'd like to introduce our special guest for today, Dr. Jeffrey James. Dr. James is a board-certified chiropractic neurologist. He's board eligible in neurochemistry and nutrition, as well as vestibular disorders. He studied hundreds of hours in traumatic brain injury, blood chemistry, functional endocrinology, including thyroid disorders and diabetes. You okay there? He's
Perfect. Just got to turn the phone down.
okay. He's currently studying for his diplomate in nutrition through the American Board of Clinical Nutrition. Jeffrey, thanks for joining me here this morning on the Rational Wellness Podcast.
Pleasure, Ben. Thanks for having me. Although you just stole my thunder. You know so much about diabetes. What do you got me here for? You should just you got it down, brother.
Hey, I know you're a very, very smart guy, and I've just touched the surface of this epidemic. So I'd like you to enlighten us with some pearls of wisdom that you've gained from your experience in working with hundreds of thousands of clients with diabetes.
I'll
So
do
the
my
first
best.
question I want to ask you is, what do you think is the biggest factor in our society that's contributing to the increase that we're seeing in the rate of diabetes and pre-diabetes?
You know, I'm not sure that it's any one thing. I think it's multifactorial. I think it probably started in the 80s when everybody got so scared of saturated fats. We went to this sort of high carbohydrate, refined carbohydrate, and margarine unsaturated diet. That didn't help things. I think, you know, as the advent of cell phones and computers have gotten bigger, we're sitting around on our duffs more, and we know that sitting around and having a sedentary lifestyle absolutely contributes to all sorts of issues, increased mortality, just sitting around on our duff, you know, that is not balanced actually by going to the gym for a couple hours a day, interestingly enough. So I think the combination of that, our diet, our stress level, and refined foods is really probably it. And then, you know, you can put all those things together and you're living a stressed lifestyle, sitting in front of a computer, and not moving your body and eating Cheetos all day long. You're pretty much setting yourself up for, you know, you're going to be a mess metabolically at some point.
Right. So you mentioned stress, and can you go into a little more how stress plays a role in blood sugar regulation and diabetes?
Yeah, I don't know that we know everything that we need to know about how stress impacts that, but we know that one of the jobs of cortisol is to raise our sugar levels when it's low. And so you spoke about, you know, glucose spikes when you eat a refined carbohydrate and you get an insulin surge. But the converse of that is when the insulin surge comes down, you end up having low blood sugar.
Right.
In fact, most of the diabetics that I have treated were more fearful of the low blood sugar levels than they were even of the high blood sugar level. That's when they get scared and they start to feel like they're not in control, right?
Right. Plus, of course, you know, if the blood sugar gets too low, they can go into a diabetic coma and die.
Yeah, not a good thing.
No.
Not advisable. And so, so the job of cortisol when your blood sugar is low is to basically pulse and release some glucose from your liver to keep you stable. As an example, a normal function of this is when we're sleeping at night. Obviously, our metabolic rate is decreased, but we still need fuel to run the machinery while we're sleeping. And so normal function would dictate that as your blood sugar level starts to drop below a normal level, that your brain was going to secrete some hormones that causes your adrenal cortex to secrete some cortisol to release some sugar to keep you stable. What we see for some people is if they've been under stress for a very long time, as an example, their cortisol levels may get depleted, and we can test that. And you probably have talked about this on podcasts. You can test this. And as you see the cortisol levels get depleted, then the body goes to DEFCON 2, which is to use epinephrine and norepinephrine. So epinephrine and norepinephrine are hormones that will also release sugar from your liver, but they have the added effect of stimulating your sympathetic nervous system and waking you up. So folks who wake up at 2, 3 o'clock in the morning and they're wide awake, that may be a blood sugar dysregulation issue as a consequence of being under so much stress that your cortisol levels are depleted. That said, if you're under a lot of stress during the day, then you're probably secreting a lot of cortisol during the day and releasing more and more of glucose out of your liver. If you add that to the glucose that's already not able to get out of your system because of the insulin resistance, because of a poor diet, you're just compounding the problem for yourself. And this also creates a sympathetic response. And so none of this is really terribly good for us, particularly if you're having difficulty maintaining your blood sugar level. So stress, that's one aspect, I would say. What I've seen and learned from Dr. Schroeder, who you met also, is that as people's cortisol levels deplete during the day, they start to actually run on adrenaline. And so that's another issue, right? So you start running on adrenaline, you get edgy, you get a little bit irritable, you don't think as good. And so being under chronic stress, obviously, we know is a really big deal. And we're not just talking about, really these days, we're not just talking about emotional stress, but the stress of, if you will, of EMFs and all the electricity and all the things that are basically polluting our nervous system are creating stresses that we probably never had to deal with in the entire history of humanity.
Interesting. You know, when we think about diabetes. We're usually focused on diet and blood sugar regulation. And I know we're going to get into that a little more in a minute, but you bring up this whole idea of cortisol, which is related to stress. And so it's something I think a lot of people don't focus on, and people maybe who are trying to eat a little bit healthier, and then they find their blood sugar is still spiking and they just can't figure it out. You know, you're bringing up something really important and interesting, which is that if they don't find a way to manage and control their stress and calm their adrenal glands down, that simply following a healthier diet is never going to be effective.
Well, you know, it'll be helpful, right? But you may find that you're just never able to get your place into a range that you're comfortable with, or that your doctor is comfortable with. And, you know, there's a couple of ways of handling that, but we all live in a society, and I have to, like you, right? LA is a very stressful city to live in. We all have to find our way. For me, meditation is the way out to handle that. I don't really know a better way, frankly, of doing it other than to find the time to be silent and meditate. None of us, I believe, have enough silence in our lives.
Right. For me, it's going to the gym. So even though we were going to record this at 7, I got to the gym at 4 today so I could get my workout in and get home.
Look at you. Such a stud.
You know, that's my sanctuary, is the gym.
Absolutely.
I know
Another good way.
So,
but it's interesting. It's an interesting point, I think, to raise, and that is, for some people, overtraining is a stress also.
right.
So, you know, you think you may be giving yourself a stress release, and you are on some level. You may be working out some of that adrenaline, but if you're overtraining, as you well know, you've been doing this for a long time, that's another stress to the body, and that will involve your adrenal glands again for recovery.
Absolutely. Can you say CrossFit? I know you're a chiropractor, and we see a lot of patients, unfortunately, who are overtraining because of this CrossFit trend that we see in society. Not that CrossFit can't be an effective form of training, but because of the way it's set up, I think that there's a tendency for people who want to exercise regularly, they probably overtrain with some of those programs.
Agreed. But you can do it just by being in the gym. I've done it. You know, I've done it. You train, and people go, "Oh, well," your trainer goes, "Well, you just, you know, I'm really sore. I don't think I can lift again." No. You just need to work through that, right? As you continually break down your body.
Yeah. So I want to bring up toxins. As you are well aware, there's a considerable amount of research that's been building up showing that various sorts of toxins, and, you know, obviously our environment is just loaded with toxins from everywhere. But for a very simple one is bisphenol A, or BPA, and this has actually been shown to affect your metabolism and significantly increase your risk of diabetes. Have you seen toxins play a role in diabetes, and how have you handled this with your patients?
Really good question. You know, I wasn't testing that so much, although I recently just tested a patient the other day who her markers weren't making sense, and she had all sorts of immune responses, IgG, IgA, and IgM responses to bisphenol S, A, and S. She had some responses to formaldehyde, glutaraldehyde, and benzene rings and things. So we know that the plastics are endocrine disruptors, right? So we know that that's just a bad thing. But the problem is that we've all been fooled into thinking, well, if you get rid of the BPAs, you're fine. No, the other plastics are not fine either.
Right.
And honestly, I think that, you know, it's interesting if we think about this. I haven't had to deal with it too much directly. People who have these kinds of issues, you know, you can detox a number of different ways. And I tend to put people on, you know, like you do, some things that help phase 1 and phase 2 detoxification pathways in their liver. Right. But getting into a far infrared sauna is good if you have these plastics to get this stuff out of your system. But I think the interesting thing is that since we're talking about diet, the two things go hand in hand. So people who tend to eat refined foods and prepackaged foods are eating them out of packages that have BPA in them.
Yes.
So when you start to clean it, and you know, one of the things that I do, I'm sure you do, is you get people eating real food. And when they start eating real food and they stop eating refined foods, they're also eliminating the amount of BPA and toxins that they're ingesting vis-a-vis the packaging itself.
Right.
So I think that's one aspect, but My wife actually has been much better about this.
By the way, I just wanted to mention, this is one of the most frustrating things. You're trying to eat clean, you want to eat organic, it costs so much money. So you go to Trader Joe's, you go, oh, great, I got this organic chicken, and you bring it home, and then you realize that it's sitting on styrene covered with plastic wrap, and, your super clean chicken isn't so super clean.
That's true. My wife alerted me to this, and I used to go, oh, no big deal. It is, all the receipts that we get coming out of the machines, when you go to the supermarket, you go to the gas station, all those receipts coded in BPA. So we're just, every day, how many times you handle receipts and it's getting absorbed.
You want to hear something really frustrated about it, because, in my office, we've been using BPA-free paper for a number of years now. It wasn't so easy to get. Now it is. Except I recently discovered that even though the BPA-free paper we're using doesn't have any BPA added to it, because it's made from recycled paper, and there's BPA paper that goes into the recycled paper.
Brilliant.
And then because so many people have touched cash register receipts and have touched dollar bills, if you touch money, you got BPA. So basically, if you do anything with money, you've got BPA.
Right. I mean, I think, we can't go too crazy with it. I think that in general, if you're not overexposing yourself, that your body may have some ability to handle this. But any amount of these chemicals for most of us is not good. They're endocrine disruptors, and God knows we're going to only find out more and more about this as we're able to study more and more about these chemicals. Right? And the problem for us isn't just the BPA; it's the onslaught of all these other chemicals, from glyphosate to the carriers and the adjuvants and vaccines that we've all been exposed.
By the way, glyphosate is what's in Roundup, which is sprayed on some of the crops.
Thank you. Yes.
Yeah, go ahead.
So, our bodies are contending with a chemical onslaught like we've never seen before. Right. And, not to get into the vaccine conversation, but the adjuvants and all the chemicals that are in vaccines is preloading the immune system already, bypassing all of our body's natural barriers, if you will, to the exposure to these toxins. Then we're ingesting them through the foods that we eat and the chemicals that are sprayed on the foods. Then we're eating foods that are chemicals.
Right.
I was out to a daddy-daughter dance with my daughter the other day, and, she's pretty clear about eating gluten-free, not just for the gluten, but because of all the glyphosate that's sprayed on the gluten.
Right.
And she has a friend, and her friend came up and just basically shoved a Snickers bar in her face, just shoved it in her face. And my daughter didn't want to be rude to her, and she didn't know what to do. And she said, well, you could have just taken a bite and spit it out. And she's 8. She didn't know what to do with it. But isn't it interesting? That's pure chemical. And she said it really didn't even taste good. She's so used to eating real food that for her, she goes, it was kind of yucky, Dad. I said, yeah, it's all chemicals. It's not real chocolate. I don't mind eating real chocolate.
Right.
But then coming back to your example of the chickens and all the food, wrapped in plastic, but all chickens, well, I guess not organic chickens, but chickens are raised now also with arsenic. I mean, the level of chemicals that we are just bombarded with, it's almost impossible to stay entirely clean, which is why, in a sense, you need to constantly basically be cleaning up our system and allowing our system to be able to detoxify. Right. So, if you're constipated, you're not detoxifying properly. Right. If you're not drinking enough water and you're not sweating, you're not detoxifying properly. And eventually your system is going to crash. And depending upon what your genetic predisposition is how your body will express that, right? So right. I don't know if you've ever used this example, but I used to, when I did seminars for diabetics, and a lot of diabetics would be really just going, they're just depressed because they go, well, it's just inevitable. My whole family has it. My brother, my sister. I said, listen, genetics loads the gun, but your environment pulls the trigger.
Right.
So that had people kind of go, oh, right. So it's not there are people who have genetics to express cancer, but they do not. So just because you have the genetics to express a diabetic expression doesn't mean that you have to go down that road. It may mean that you have to be a lot more careful.
Right. Good. So what dietary approach do you recommend for patients with diabetes, or does it depend upon the patient?
Well, I guess it does depend upon the patient. The trickiest group of people to help for me have been vegans with this and vegetarians. I find that there's multiple systemic failures with a lot of diabetics. That they also have leaky gut. They've also got a lot of multiple food sensitivities. Probably 30% of them have thyroid issues. So for me, a paleo diet seems to be best for a lot of these people. They seem to respond best to I'm not talking the Atkins thing where you're sitting down, you're having a brontosaurus steak this big, but and just loading yourself with fat, but being more more using fat for energy more, and using the good organic pasture raised beef and proteins and good fish and plant vegetables seems to do a tremendous amount of good. And as I said before, it gets people out eating the packaged foods that are basically wrapped in plastic or canned foods, you know? So, the first step for me is no more packaged foods, no more processed foods, no more canned foods, right? I typically, for a short period of time, I don't know how you handle this, for a short period of time, I say no gluten and no grains and no fruit except for berries that are low glycemic index.
Right.
And depending upon, then we test people, and depending upon their food sensitivities and what's going on with their gut, that will determine sort of the dietary approach after that. But for a few weeks, I'm a pretty tough cat that way. It's like, listen, the pendulum has swung all the way over here. We're not coming here for a while. We're going over to this side for a while.
Right.
And we're going to be really strict and give your body every opportunity it has to reduce the inflammation that is as a consequence of what you've been doing to yourself for all these years, but also to reduce the insulin surges, right? So, what I've seen is the arc of this disease, if you will, or syndrome, is that people start typically on the hypoglycemic end for many, many years. Like, you grew up in New York, right? You're a New Yorker guy?
Yep.
Yeah. You have to be, right? So me too. I grew up on Long Island, right? So the average New Yorker, right? They're grabbing a bagel and a black cup of coffee, right? They're getting on the Long Island Railroad at 6 o'clock in the morning to take the 30 to 80 minute ride into Manhattan.
Yeah.
For years when I was a kid, I didn't even see daylight because I'd get into Penn Station and do the subway thing, and it would land right into my building, and I'd go right up to the top of the City Corps building, and you come out and eat a dirty water dog. So, that's, for those who are listening, that's a piece of meat, something that resembles meat floating in hot water, a white starchy nothing like Wonder Bread bun, and you spread some butter on, and that was your lunch,
Yeah.
And you have to think that, so you've gone from dinner to that, breakfast, the bagel and the coffee, and your body goes, I'm starving for a carbohydrate, so it creates an insulin surge to extract every last bit of energy out of that, right? So there's your insulin surge. And then you go another 6-7 hours and you eat another crappy processed meal like that dirty water dog, and you create another insulin surge. And then by the time you get home, you're so exhausted that you probably stop off at Burger King and McDonald's. And this is your life for a while, and you go hypoglycemic until you have enough of these insulin surges where you start to get insulin insensitivity or receptor insensitivity. And the analogy that I like to use is insulin is like a key going into the lock, and you can have the right key, but if you try to stick 50 of the right key into the lock, it jams the lock. And so now you start to move into that stage where, as you get into maybe your 30s, late 30s, early 40s, 50s, where insulin is no longer effective, the receptors are shutting down, and now you have elevated levels of sugar and insulin. And that sugar and insulin is extraordinarily corrosive, as you know, to our blood vessels. It starts to basically rip up our blood vessels.
Yeah.
The body goes, hey, we got to deal with this. And so basically it gets into the liver and it starts to convert it into cholesterol. And cholesterol then gets used to spackle the arteries. And then everybody looks at the arteries and goes, oh my gosh, cholesterol is high. We got to deal with this. But, next to that, you could also have a hypothyroid condition, which is also messing with your lipids and causing elevated cholesterol and elevated low density lipids and depressed HDLs, compounding the issue. And so what I've just found is that you got to really cut down on the carbs, extraordinarily, and eat vegetable carbs. And you can have squash and you can have yams and sweet potatoes, but you got to really cut that back and give the receptors basically a rest and get them to calm down so they can start to be effective again. And I have seen miracles. I have a woman on my website who her blood sugars were in the 400s, and she had polio as a kid, and her doctor told her, you're not going to be alive in 2 years.
Right.
And changing her diet and basically doing a phase 1, phase 2 metabolic detoxification pathway. And I believe she had some parasites. We handled that. I mean, her blood sugars, she's basically not diabetic anymore. You look at her numbers, she's just not a diabetic. And so the hopelessness that diabetics feel is as a consequence, I think, honestly, of how they're treated in the traditional medical model.
Sure.
Which is, here's the metformin. Oh, that's not working. Here's glyburide. Here's glipizide.
Right.
That's not working. Then your cholesterol levels are. Here's the statin levels, which lowers your testosterone levels, which means you start to lose lean muscle mass, which is where your insulin receptors live.
Brain stops functioning properly.
Brain stops functioning. You can't think well. Yes, you've been dumbed down to thinking your
levels going down, and
So, I'm not licensed to take people. I don't take people off their medications. We like you do, we fix their physiology, and what's broken the physiology, change the diet. And all of a sudden, all the little symptoms, all these things just start to drop away. And you mentioned it in your opening, one of the things that occurs is increased clotting. This is as a consequence. All of this is a consequence of the insult is insulin resistance.
Yes.
And the insulin resistance is a consequence of mostly of diet. There are some other players there, right? But when you start to decrease, plasmin activation inhibitor, you start to increase clotting factor. And as you said, I think the number I saw is people who are diabetic are 60% more likely to have a heart attack. I'll give you a personal example. My brother's been a diabetic for years, didn't tell me. And when he finally fessed up to it, I said, well, let's fix this. So we did. But he defaults to eating a certain way. He doesn't typically eat terribly, but he eats way too much. Like he'll have the brontosaurus thing, right? And so I noticed that his weight fluctuates. And I saw him a few months ago, and we had coffee together, and I said, what's going on with your numbers? He goes, yeah, not so good, stress, blah, blah, blah. I go, Michael, you don't get to mess around. My brother's 61 years old. I said, you are that guy, right? You're 60% more likely to have a heart attack or a stroke or any of this stuff if you don't start exercising and taking care of yourself. And I said to him, do you hate exercise more than your diabetes? And you know what he said to me? Apparently. I didn't even know what to really do with that. Well, that night, he flew up to New Jersey and started getting chest pains, flew back down to North Carolina, and 2 days later, he was rushed into the ER. He had a heart attack.
Wow.
And they did a bypass. It's like a military operation, a really smooth thing. Now, the fortunate thing for him is really good doctors here at Duke handled his thing for him. The unfortunate part is it's so easy to have a heart attack and be fixed. It was like a blip on the radar. I think it woke him up a little bit. So here's the end of this story. So I'm sitting in the hospital room with him, and one of the people from the cardiac team come in and say, hey, your blood sugar levels are out of control, so we're going to put you on insulin. And I just, I said, really? And my brother said, let them just do what they got to do to keep me alive. And I said, yes, but do you realize that what the problem is here is that you already have too much insulin in your body.
Right.
So adding more insulin is going to eventually shut those receptors down for good, right?
Right.
What are you going to do? Family doesn't listen. So he is actually now, he's been rehabbing himself, and I think it was a bit of a wake-up call. He is exercising, much to his own chagrin, and he has gotten himself off of the insulin, but he's still having to take, pretty healthy amounts of medication. It's depressing to me in the sense that, as you already know, this is one of the most reversible diseases on the planet. It requires discipline. It requires the discipline of not putting the piece of chocolate cake in your mouth, right?
Right.
It requires eating the foods that are life-sustaining for you and are beneficial to you. That's really what it comes down to, and having a discipline to exercise and work out. And as we get older, here's the other challenge, right? So this, as you get older, we start to lose our lean muscle mass, and we're producing less testosterone. Well, where are most of our insulin receptors? In our lean muscle mass, right?
Right.
And if you add a statin drug on top of that, which for many people is actually not only destroying lean muscle tissue but also nervous system tissue, you really start to fight a losing battle. So working out and keeping your muscles, keeping muscle tone is critical as we age, or blood sugar regulation.
Right. And of course, this functional medicine approach that you're outlining is, if this approach was followed more commonly, could save our healthcare system, billions and billions of dollars. Because
yes.
The other model is you see this truck that's rolling downhill, and you just manage it with more and more medication as it continues to roll downhill, and eventually it's going to crash, and you're going to end up with the end result of diabetes, which is kidney failure or getting your leg amputated or all of the above, and early death. And and this is one of the main problems why our healthcare system is so expensive. And so it's good that you're helping me get this word out so we can let people know that there's another approach.
I mean, it's no joke. I mean, the funny thing about diabetes as well, to me, is when doctors talk about, my doctor says I'm pre-diabetic or they have metabolic syndrome. We have this arbitrary number that now the ADA has picked up. If you have two fasting blood sugar levels in a row of 126, you're now a diabetic. But actually, if you look at the A1C, it doesn't match that. The A1C is actually higher, right? So, there are people, and I'm sure you've seen this too. I've had people who come in and their glucose numbers are crazy, like their fasting blood sugar numbers are in the 200s, and they say, my energy level's fine, I feel good, I don't really have any issues. And then you see people who have blood sugars and maybe they're 110 and they feel like crap.
Right.
My blood sugar starts to get up near around 100 or so fasting. I'm not feeling so good.
Right.
So I have a certain, obviously I have a predilection. I don't respond well to high blood sugar. I've got to really keep it under control. But there are people who do, and that's a genetic thing. So this arbitrary marker that we have of, when you're a diabetic, I'll put you on your medications. No, you're already showing the signs you're tilting out of control here. Let's bring you back before you actually have a named disease.
Yes.
Is what you're promoting here, and that's exactly right. It's just crazy to try, we've got this truck careening down the hill, and let's keep throwing stuff at it to try and slow it down.
Right.
No. Got to jump in and steer the truck away.
Yeah, no, absolutely. I was just talking to a patient the other day, and his fasting blood sugar was 105. And I said, that means you're pre-diabetic. What are you going to do about it? And he said, well, my doctor said, we'll just wait till it gets over 125. Then I'll go on medication.
Or you're right. Or you'll find the aggressive doctors who will say, well, I'll put you on metformin prophylactically, and we'll also put you on lisinopril or hydrochlorothiazide to protect your kidneys prophylactically. Wait, does anybody going to talk to them about their diet and their lifestyle? It takes too much time. And so I think this comes to the crux of it, right? Which is we're all waiting for our insurance to pay for our health. And if our insurance truly were health insurance and not sick care insurance, it would pay for organic fruits and vegetables, right? It would pay for pasture-fed and grass-fed meat. It would pay for the gym membership and a trainer.
Right.
It's not health insurance, as we all know. It's crisis care insurance.
Of course.
And then we're mad when we find practitioners who can help us, but insurance doesn't cover the tests and the things that they want to do to help us.
Right.
Because it's not healthcare.
Of course.
Healthcare, not healthcare. So you can either choose to get sick and use your insurance, or you can choose to get well and get healthy and find people who are properly trained in helping you move your body back in that direction.
Like functional medicine practitioners like yourself and like me and many others out there. So one more question is, for those of us who are trying to help our patients when diet's not enough, I have found, and I'm sure you probably have, that specific use of targeted nutraceuticals or nutritional supplements can be helpful. What nutritional supplements have you found to be especially helpful for patients with diabetes?
That's a tough question, Ben, because I think that there are things that you can use in general that will help people with blood sugar regulation. We all know, like cinnamon and chromium,
right?
Things like fenugreek and gymnemna. I can never pronounce it. Gymnemna sylvestra. I think that somebody did that to me on purpose. Named it that. Gymnemna. But the way that I like to approach it is not as a general sort of shotgun. I like to do the test and find out specifically what's missing or messing with them, and then give a nutraceutical specific to their own dysfunction. So, if somebody has a thyroid dysfunction, is it a primary thyroid dysfunction, or is it as a consequence of Hashimoto's? And they look at dietary things and what supplements would they need for that. If their liver isn't functioning properly, well then, maybe it's Silmarin, but also probably going to give them a broad-based medical food to help them with their phase 1, phase 2 pathways.
Right.
If it's an adrenal disorder, you look at things to support the adrenals and what you need to do there. And for many, many patients, we haven't even gotten a chance to touch on this yet. There's a lot of research coming out now that staph infections, which are more common in obese folks, and they tend to basically harbor the staph infection, also generate and can cause diabetes. And intestinal disorders and infections can be causative and part and parcel of that. And so oftentimes you need to use herbs to basically kill critters. And sometimes if that doesn't work, you need to put people on antibiotics. Not us. We have to refer them to get somebody to put them on antibiotics to kill those critters. And then you have to rebuild the gut. So that's my approach. So that's to be a bit more focused in terms of the nutraceutical look. But things like fenugreek are good, and chromium picolinate are good, and CLA are good. All those things are good, which is why our cabinets, all of us have cabinets full of tons of supplements, because we're hoping there's that one silver bullet that's going to fix it, right?
Right.
I think a better approach is for a patient to come and see somebody like you or I or a functional medicine practitioner, get the appropriate testing and find out what's really out of balance, or is there anything out of balance, and then put them on the nutraceuticals that are appropriate for that particular person.
Right. Great. Just one more question on the...
Only one? This is fun. I like that.
And this will be our final question. Neuropathy is a frequent problem for patients who haven't managed their diabetes properly as it starts to advance. And this is often a really painful and uncomfortable condition. And so, besides taking a complete functional medicine approach and trying to reverse some of the underlying physiological reasons for their diabetes in the shorter term, what kind of nutritional supplements can help with managing neuropathy?
Kind of the same answer as I gave you before.
Oh, okay.
A little tricky, but here's the thing. But here's the thing to be concerned about, right? If your body is exhibiting neuropathic symptoms in one's feet, as an example, then it's happening elsewhere in your body. It can't not. It's a systemic issue, right? It means that this is why the number one cause of blindness in the United States is diabetic retinopathy, right?
Yes.
So it's happening in your brain. It's happening in your eyes. And here's the sad thing. It's also happening in your gut. So we don't talk about this a lot, but you can have an autonomic neuropathy, which means to say that the nerve fibers that are causing gastric motility are being disrupted. And so if you start to get a neuropathy, you have changes in your peristalsis, in your gut motility, and that then it becomes this really bad vicious cycle. So, you can look, there are some people, for instance, who may have a B12 deficiency, they may have a pernicious anemia, they may have a methyl defect, and they need to be on some methylcobalamin, or they need to be on something like that might help that. But oftentimes what I see with diabetics is it's as a consequence of what we talked about before, the insulin resistance, causing an increase in glycosylated end products, causing an increase in cholesterol being laid down. And now these tiny capillaries and arteries are being clogged up. And so the nerves can't get the blood supply that they need. And nerves, whether they live in your big toe or they live in your brain, need three things to live. They need a steady supply of glucose, they need a steady supply of oxygen, they need to be activated. So when you're walking, right, you're activating those nerve fibers and those nerve receptors all day long. But if the fuel delivery isn't there, those nerve fibers are going to die. And guess what you experience? Burning pain in your feet.
Right.
So exercise, movement, I found in some cases, not in all cases, but we've used some infrared lights and lasers that have been helpful for patients with neuropathy. But I don't love treating neuropathy from that point of view because I don't find it to be terribly predictable. Some people do really great and they think, oh my God, you performed a miracle. And the next person comes in and it just doesn't seem to do anything.
Yeah.
And the mechanism that we believe that these lights work on is based upon nitric oxide basically being flushed into the system. And as we know, nitric oxide causes a vasodilation. And where there are three types of nitric oxide, only one of them is really beneficial. I think the lights are hopefully activating the one beneficial one. But why does that work for one and not another? I don't know. So the same thing of giving a supplement for neuropathy. And we start talking like that a little bit as functional medicine practitioners. I think we've fallen a little bit into the trap of treating nutraceuticals like pharmaceuticals. So we get out of the trap because everybody wants to, what's the supplement I can use for that versus what's the underlying cause that I need to handle to get rid of it?
Right.
Rather than let me just treat this with that.
Right.
And that allows you to continue having a crappy lifestyle and something that's not life-sustaining, but do this thing that kind of tricks you into feeling like, oh, I'm okay, right?
Right.
So I'll have my chocolate milkshake, but I'll put a half a cup of cinnamon in there.
Exactly. That's great. Yeah, that's the key. It's not focusing on the symptoms, but the underlying cause. So this has been a really fascinating talk, Dr. James, and you've brought us a lot of interesting thoughts and insights into how to treat some of these conditions. I just wanted to mention that even though you and I both have criticized some of the conventional medical approach to treating diabetes, and I think you probably—
Some of our best friends are MDs, right?
Exactly.
I've got MDs in my practice, in my office.
Which is that even though, we're advocating this functional medicine approach, we both believe that a patient would be best served by both having a good conventional medical doctor and a functional medicine doctor and working in concert for the best of the patient rather than one or the other.
Agreed, 100%, wholeheartedly.
So Dr. James, for patients who are listening to this, what's the best way for them to get in touch with you?
Office number is 310-575-5575. 310-575-5575, or they can find us at integratedphysicians.com.
Okay. And is that number for your office in Los Angeles or in North Carolina? Or?
That's for the office in Los Angeles.
Okay.
But I use that number actually also for the office here in North Carolina. People can schedule through LA.
Okay. That's great. Thank you so much, Dr. James.
Hey, thank you, Ben. It's really been fun.
Excellent.